Did you go to have it removed? The wisdom tooth, there was an accident, it was a difficult extraction, and then after the procedure, the anesthesia didn't wear off. And now you're here watching this video to get information on what to do about this burning, stinging, and tingling on the tongue that won't go away. Folks, first of all, I want to know who you are. Are you a patient who had an injury this week? You just left the dentist, your tongue is numb, he already told you it's a lingual nerve paresthesia, and you're unsure what to do in these first few days, or are you? Are you that patient who had an injury a long time ago, more than 6 months, and is suffering a lot because you don't know what to do? Your dentist has already given up on you. The doctor you went to knows absolutely nothing about this, and you are completely lost, suffering with pain at home. Well then, if you are the first patient who just had the injury, here is an extremely important tip. Calm down. Why? Because the chance of you recovering from these symptoms is extremely high. Most patients, more than 90% of them, improve after a few days. Because the dentist only got close to the nerve injuring it. A little, but the nerve will regenerate. In other words, it is still connected to its own cable and will regenerate, and you will improve your symptoms. However, if you are a patient who has already gone through a few weeks, a few months, you have burning in the tongue, you have stinging, and you have reached a plateau, meaning you are not improving over the last few days, maybe you have a more serious injury, and perhaps your treatment will be a bit more difficult. So I want you to stay in this video until the end, because I will explain all the treatments available today. For the patient who has severe lingual paresthesia, meaning their nerve was cut, first of all is the diagnosis. Is it really a paresthesia of the lingual nerve? Some things you can see that lead us to understand that it is. For example, it was right after the removal of the wisdom tooth. You didn't have this before. You went to remove the tooth, and right after, you started with this burning sensation on the tongue. This is not trigeminal neuralgia, as they might have told you. This is lingual paresthesia, if you don't have burning on both sides of the tongue. And it started after the removal of the wisdom tooth. It is also not a syndrome of oral burning. It is a lingual nerve paresthesia due to nerve injury. Understanding this, let's move on to the diagnostic investigation. First, there is an exam that can help, which is the MRI with nerve neurography. This exam is not 100% reliable. I have had patients who underwent surgery where the exam showed the nerve was intact. And I have had patients where the exam showed the nerve was injured, however, it improved over the days. So, it is not a 100% reliable exam. What matters most to me is really the progression of the symptoms. For example, you have a burning sensation that fluctuates. You wake up in the morning with your tongue feeling fine, start talking or eating throughout the day, and then, by late afternoon on a stressful day, it becomes unbearable. You can't even speak anymore, you just want to lie down in bed and sleep. So, if these episodes are daily at the beginning, you have them 3-4 times a week, and then, in the following month, you reduce the number of episodes to once or twice. That is a sign of improvement. If the burning sensation on your tongue is a level 10, and then after a few months, it decreases to a burning sensation. 2, 3, it means that your symptom has improved significantly. That's another sign of improvement. Maybe your injury wasn't that severe. Now, if you have weekly episodes that remain at the same level of intensity and frequency after a few months, you haven't improved. Your injury is probably severe, regardless of what the MRI says. In this case, folks, it's worth seeking a specialist in peripheral nerves. This is the doctor who usually performs nerve reconstruction to help you improve. And this reconstruction needs to be done before a year of pain. I have treated patients with 6 months of burning sensation in the tongue and also patients with more than 6 years. And believe me, the longer your body has experienced pain, the worse the surgical outcome. We perform the same procedure for all patients, however. For those who have spent many years suffering from the pain, after the surgery, it seems like the pain doesn't go away, as if the brain has learned to live with it there. So, don't wait too long to undergo your treatment. Another important factor is psychotherapy. You notice that your pain crises fluctuate with better days and worse days, and on days when you are very stressed, this pain can occur. Does it worsen a lot? Well then, it's not just in your head. Don't believe it's something you can simply forget. No, in reality, the neurons of emotions are connected to the pain location in the brain. A day of anxiety will lead to a day of pain. And pain also activates the anxiety area. That's why they go hand in hand. And medication that controls anxiety and psychotherapy will also reduce your pain crises. Therefore, the use of medications, psychotherapy, we can also perform nerve blocks in the tongue with a needle and medication, and also nerve reconstruction. This is the treatment ladder for patients who have lingual nerve paresthesia. I hope that you have understood the treatment. Here, we do not make diagnoses, nor do we recommend a procedure. Each patient, each degree of symptom, with its evolution over time, will dictate which treatment to choose. Therefore, seek a peripheral nerve specialist so that you can have a diagnosis and outline a plan, because you should have the best result by undergoing appropriate treatment. Do not let it become chronic, because once the pain becomes chronic, no matter what you do, the result will be poor. If you want to know more information about lingual nerve paresthesia, like this video and follow the channel.